video is a little graphic, so if there is anyone that might step out before we play the video, it shows the signs and symptoms of someone that is using or could be abusing the drug, and I just want to make sure, I think it's important for you guys to see in terms of awareness, education, so you guys can look around in your household, but I would never want to make anybody uncomfortable. With that, I'll go ahead and play. I show that video for two reasons. One, I want to make sure that we all know the signs and symptoms of drug use and abuse. The second is the statement that they put at the end of that video. Our office did not work on that video. That video was put together by a group called Let's Face Heroin. The last thing they said, if you guys noticed, was enough is enough. And I think I even heard Kelly mention that someone said it to him as well. And it's not, it's one of those things where we need to say enough is enough to dealing with these issues, ignoring these issues. And hopefully today, by the end of today, we'll have some ideas on how we can address these issues in Portage County. All right, so here we are. Regular Alisha's back. I want to first start by saying that I have been a part of the heroin unit for about a year now. I come from the Adams Port of Franklin County, where I worked for about 9-10 years, Coos County, right? And have been around these issues, mental health and addiction issues for a while. Can say that I have never seen it in this manner and be this bad. And so I'm glad we're all here today because we all, I think, understand how important it is to talk about these issues. To really get into talking about these issues, and you guys should all have a copy of this presentation in front of you, so I won't go through this thing word for word. I know we're crunched for time. But I do think it's important for us to all understand kind of how we got here. How a perfect storm of events happened and transpired in nation, let alone Ohio, that have made it possible for us to have the addiction issues that we're facing today. To do that, I want to first look at the national numbers, just to give you an idea of what we're looking at. So nationally, what you'll see on this slide here is that overdose, from all overdoses, this is not just opiates, heroin, all overdoses surpassed motor vehicle deaths in 2009. And, that's a big deal for us as a nation. For so long, we were concerned about motor vehicle incidents, we were concerned about motor vehicle deaths, and I don't know if you guys have seen the ODOT signs that are around the state of Ohio that say how many deaths so far this year. Those numbers always shock me. And to know that motor vehicle deaths, overdoses surpass those, is astonishing. So take a look at that in Ohio. We're a competitive state, right? We have Cleveland Indians, we have the Cavs, we have the Bucks. Unfortunately, we were a little bit too competitive in an area that we shouldn't have been, and that is addiction. And so you see that Ohio surpassed that number in 2007. So we have had a long-standing issue with addiction, and are one of the leaders in the nation in terms of addiction issues. And as we look at this opiate epidemic, we're also leading in the country. So what does that look like over a time span? In 2002, you'll see on the right, my right, your left, most of the state was blue, and what that blue represents was 5 or less deaths in a year. In 2014, we can see that state looks a lot different. We see a lot of areas of red, and those areas of red include 25 deaths or more, and that's what we look like in Portage County. I'm from Akron, by the way. It was funny. I walk in the door and I see one of my cousins. How you doing, buddy? I was like, wow, this is funny. But we've had in Northeast Ohio, we're getting hit pretty hard. Cleveland, Akron, Portage County, getting hit pretty hard with this, and those numbers reflect this as well. So, how do we get here? There's two major pieces, and there's a few things that I could touch on, but I won't get too deep into it because I want to make sure we spend some time educating ourselves about medication-assisted treatment, make sure we have time for our exercise that we'll do later today as a group. This will not be us just talking at you today. We'll definitely get you guys up and moving to do that exercise, as well as that facilitated discussion where we want to hear from you in the audience with your questions. We want to hope that we have answers for you today as well. But before we get there, let's talk about how we got in this situation in the first place. And so to do that, we look at a couple different things that happened. One of the major things that happened in 1998, was Purdue Pharma produced a pill called Oxycontin. Anybody heard of Oxycontin? If you haven't heard of Oxycontin, almost you've been living under a rock. I think it's pretty common. The second piece that happened in 1998 is they they allowed introduced the concept of the fifth vital sign. 96, 98, somewhere around there, they introduced the fifth vital sign. And so those two things kind of catapulted the issues that we're seeing today in terms of the use of opiate as a pain reliever, and it also talked about and introduced a culture of pain management. So when you go to your doctor, what is the first thing they say to you? On a scale of 1 to 10, all right, what's your pain? And so that whole conversation, those conversations is kind of what started some of this, not all of this, and put us down a rabbit hole. So I'm just going to go through what that timeline looked like and what changes happened because of that. So in 96 when that happened, 98, two things happened that were key to this, and one of them is in Portsmouth, Ohio. Has anyone ever been to Portsmouth? Small place, right? Portsmouth, Ohio, Sauter County was the birthplace in most folks' estimation of pill mills. We had more pills per capita in Portsmouth, Ohio than any other county in the nation. So if you guys think about how small that city was compared to the issues that they had, that's a big deal. And we attribute that to a gentleman named Dr. Proctor, who we believe was one of the godfathers, if you will, of the pill mill and pain clinics, where you could be an individual and you would walk up to an office. Dr. Proctor had bars on his windows and doors. You walked into his facility, he had security, and you would go into an office and see him for maybe 2 to 5 minutes. You would be prescribed nothing but pain medication, and he would accept nothing but cash. That really doesn't sound like the doctor's offices that we're used to, right? 'Cause that didn't look like my doctor's office. And so he legally was doing this within Portsmouth, and little old Portsmouth was the capital for the nation on this. And so he created the model, and that model was unfortunately duplicated many, many times over across the nation and in our state. We estimate that he was making about $1 million a year and was seeing 80 patients a day. And so if you think about how many lives he was impacting with that, we definitely thought we had a problem when we realized this. And so what we were able to do is shut down the pill mills. And so we shut down the pill mills, but what do we have? A lot of individuals with addiction to prescription opioids. And we have a drug cartel who's pretty savvy in knowing that these pills were addictive and knowing the properties of these pills, and they knew that they could make these pills or a similar drug, heroin, in their labs. And that's exactly what they did. And they did that with much success. And so what we see in Ohio is that the drug cartels move in about 1998. And most of these drugs are from a city called Jalisco, Mexico, most. And this was in 1998. Of course, things have changed, and we'll talk about how they've changed in a little bit. And they were perfect businessmen. And we won't say perfect, that's a bad word. We'll say businessmen. And they had a business model. They wanted to go to areas where the neighborhoods were safe, they had access to vehicles, the people had access to money, and a cell phone. And so if you think about, if you had a choice between New York City, where drug cartels are established, where criminal activity was established and folks were known to be violent, and you compare that to a state like Ohio, where we have safe neighborhoods, we have a family structure, we got money, we got access to vehicles, it was a clear choice on where they wanted to go. And so I think that is one of the main reasons why they chose a state like Ohio, and they were very successful here. By 1998, Columbus was awash with heroin, and we'll see how that trend line affected us. And so if you remember, we talked about 96, 98, all those changes happened. Look at 2002. 2002, we had a little bit under 1,000 deaths. You compare that to what we're looking at in 2015, and it's a 500% increase since 2002. Last year, 3,050 people died. There's roughly 150 people in this room. About 19 days to clear this room. If you think about that mathematically, that's a lot of people, that's a lot of families, and that's a lot of impact. And so we'll talk about how that has impacted our community and its structure in a second. One of the things that we've seen is the introduction of fentanyl. We believe in our office, if fentanyl wasn't introduced, we might have seen some decreases in the heroin epidemic in terms of deaths. But the introduction of fentanyl into the illicit drug market has really changed some things. So most of you have heard of fentanyl, right? Not a lot of head nods, okay. In 2012, it wasn't really heard of. You see here, 75 deaths. It was really used in a controlled environment. It was used for life-ending cancer patients who were termed, and they needed some strong medicine to cope with the pain. But now we see, look at 2014 and then 2015, that this is being manufactured and sold on the streets in illegal scientific labs, unscientific labs. And we believe that that number will continue to go up. The numbers that we've seen so far this year are frightening, and we'll see some talk about carfentanil and some of the other drugs in a second. So, BCI, I know my folks from BCI are here. I don't know where he went. Oh, there he is. Scott, he's trying to hide in the back. Thanks, Scott. He pulled together some numbers for me just to show you guys how this has impacted them in the lab. And so what you'll see here is in 2010, there was about 34 fentanyl labs tested. And look at that number compared to 2015. Same with heroin cases, 2010 versus 2015, a definite increase for sure. Carfentanil, that's been in the news a lot lately. I know the incidents in Summit County. I don't know if you guys have seen much carfentanil here, but it is a deadly, more deadly. So fentanyl is 100 times more potent than heroin. Carfentanil is 100 times more potent than fentanyl. And so I show this picture because this is some border agents, and this is the Canada border, who are intercepting a kilogram of carfentanil, and they believe that was enough to kill 50 million people, I think the article reported. And look how they're handling the drug. The drug is that dangerous that they need to have hazmat suits on their entire body with masks and gloves to handle this drug and get it to a proper laboratory to be tested. Can you imagine what it would do to your body if they feel like they need that much safety and secure? And if you can see off in the corner here, that's a penny, and the right next to that is carfentanil. That is the amount it would take to kill someone. A very minuscule amount. It doesn't take a lot. I was in a meeting the other day. We had a law enforcement conference, and I heard a story about some folks in Pennsylvania where law enforcement came to a scene. The kids that were in there were using drugs, and to not get caught, they wiped the table off. Wiped all the drugs off the table and put it into the air, and many officers and people overdosed just by the substance being in the air. And so it is not meant to be used for humans. It is an elephant tranquilizer, and it is causing a lot of trouble in the state of Ohio right now. Let's take a little closer look at drug trends in this region, and then let's take a look at Portage County in a second. Drug trends in the region, if you guys have seen the OSAM reports, there's some glimmers of good and some bad news within that about this region, Portage County included. The good news is that they're seeing participants saying that they're not really seeing an increase or decrease in the use of prescription drugs, but law enforcement and treatment providers are definitely seeing a decrease in prescription drugs. So what that tells me is that the work that we're doing is working in terms of prescribing practices, the use of ORS. Have we heard of ORS? ORS is a prescribing monitoring system. And I always get the acronym messed up. What's the acronym? Oh, I won't put it on the spot. But it's the RX reporting system, Ohio Automated RX reporting system. And what it does is allows doctors, once they prescribe a medication, to input the information in the system, and people who go to try to doctor shop, for instance, the new doctor can pull up the information of what they've been prescribed before, and it will prevent them from being prescribed an opiate-related drug again or any other inappropriate drugs in the future. And so this has really been helpful across the state. We still have some issues across state lines to work with some other states, but I think we're in the right direction with that. And I think people are starting to understand the importance of drug drop boxes and things of that nature, so we're seeing a decrease in that area. Unfortunately, heroin is not the same. And so what we saw in the OSAM reports, and the OSAM report for this that we're looking at is June 2015 to January 2016. They have not released, I have not seen at least the newest version, but it should be coming out any day now if it hadn't come out already. But it's saying that the participants are seeing an increase of availability. Law enforcement is seeing an increase in availability of heroin, and particularly brown powder heroin. And treatment providers are seeing an increase. So we still have a lot of work to do in that area. Another snapshot of the state and looking at your region. This is a map that shows the estimated drug overdoses per 1,000 as of August 24th, 2016. And the concerning areas are the areas in red. And what this tells me is that the numbers are exceeding the numbers of 2015. And so the regions in red, including Portage, are seeing higher numbers in 2016 as compared to 2015. And so we have some concern and some work to do with that. But there's a lot of trends that are related to this epidemic. I brought Veronica up here. She is our lead on our Human Trafficking Commission because I think she would do a better job of talking about human trafficking, so I'll give it over to her in a second. But I wanted to touch on a couple other items. We still have people that believe that this issue is not in their neighborhood, and I will show you in a second why it's in every neighborhood and every community in the state of Ohio. Another negative trend is that we're starting to see people think of heroin and opiates as a casual drug. And I don't know if there's, we talked to a young man, and my director talked to a young man, and she said, "Why heroin?" He said, "Oh, I just smoked it. I didn't shoot it up. I just smoked it." And that scares me as a mother, as a community member, as person that works on the heroin unit, to hear people say, "I just smoked it," is concerning because there's a lack of a barrier there, and that we have to address that with our prevention programs and education programs, and we'll talk about that in a second. The other piece is, you trust your doctor, and I think we've made a lot of progress in this area, but if someone in a white lab coat gives me a drug, I trust that that drug has been vetted and it won't be harmful to me. And so some of that is from a historical overprescribing practice that we still need to work through. Another thing that concerns us is the number of active addicts. A report just came out that it takes about 6 to 10 years for some and for most of the people that were studied before they start to seek treatment themselves. We'll talk about the long-term effects of using heroin and other drugs, these heavy drugs that they have on your body. 6 to 10 years is a long time to do that before you seek treatment or help from other people. And so that's a concern that we have. Another concern is the long-term health issues in children and grandparents and babies born dependent. I'm going to go through those in length, so I will turn it over to Veronica, and then we'll go through that in a second.
Thank you, Alisha. So really quickly, the reason I'm here, I've been working on the issue of human trafficking for the Attorney General's office for about 4 years now. And when the heroin unit was formed, I was asked to be a part of it because so many of these things are happening at the same time. and they don't exist in a vacuum. You see some of the negative trends and effects right here in front of you, and what we've learned is that human trafficking and drugs often occur at the same time. For those of you who have not heard of human trafficking or are not sure exactly what it is modern day slavery. People are trafficked either for commercial sex or for labor around the world and here in the state of Ohio. So what does this look like in relationship to drugs? One particular case that I wanted to mention, and this is absolutely not the only time that we've seen this, is a recent case of a woman who had traded her 11-year-old daughter in exchange for the heroin that she needed from her drug dealer. And as horrible as this is, I mean, you can see the woman in the picture, right? Does she look like this is something she really wanted to be doing? You know, when we talk about drug addiction, people will say, and we heard earlier, that this is something that takes over your brain. The addiction, the dependency, takes over your entire life. And you start doing things that you never would have done before in order to get that drug. And we're seeing traffickers, we're seeing pimps using the threat of withdrawal as coercion to trap people in trafficking situations and to get them to do things and to agree to things that they never would have agreed to. So not only are we seeing drugs being used as coercion, like in this situation, we're also seeing more people who are going through the traumatic experience of being trafficked, starting on drugs while being trafficked. So young kids who might be homeless meet someone who ends up selling them on the street or ends up forcing them to work in their home. And because of the trauma that this causes, because of the PTSD they're suffering from being trafficked, many of them will start using these drugs in order to cope. So not only are they going through this traumatic experience, but now they have a drug addiction on top of that. And again, we are seeing cases like this more and more across the state. People who are so desperate to not go through withdrawals, not feel that sickness. And they say, I don't think there's any way to truly explain it, but they say it's 1,000 times worse than having the flu. If anyone in this room has ever seen anyone go through detox before, it's terrible. It looks like torture, and they feel like they're going to die. So when someone tells you, I need you to do this, and then I'll give you my drug that you can take and feel better, they may consider doing things that they never would have before. And if you think about anyone else who has a disease, you know, if we couldn't give diabetics the insulin that they need, what would they do to get that drug, right? In order to live and feel normal. And it's a very similar situation. So when we read a case like this, you know, our first reaction is to say, what a terrible mother. That's awful. Who would do that? But you look at her picture, and you read her story, and you realize she was desperately ill and had nobody stepping up to help her. And this is what happened. So as much as we want to blame the people who are the addicts, you know, we have to look at this situation and say, who's really to blame in this situation? And who's going to step up now and take care of that girl who was being trafficked? Because I can guarantee you she has experienced some pretty severe trauma herself. Alicia's going to talk about the kids that end up in care, and I want you to think about this woman's daughter, because I can guarantee you she either ended up in the care of a family member or in the care of the state as well, and what that must look like and feel like for her after being trafficked.
Thank you, Veronica. I never do the human trafficking piece justice, so I'm so glad that you could join us today and share that piece, because every time I think we got a grasp on this issue, there's another layer of the onion, I call it, that we pull off, and it's a whole other bag of worms that we find, and that's what's so tiring. That's what's so hard about this epidemic, is that we still have a lot to learn and a lot to figure out when it comes to how to solve these problems. One of the things that I want to show you is the addressing the not in my neighborhood issue, and BCI, and the group and the team there was able to provide a map. And what this map is showing, and it's probably hard to see on the screen, hopefully it's not too hard to see on your copy at your seat, is the naloxone administrations for Portage County. So I went ahead and put a red block around the actual county line of Portage County just to show you the sheer number of naloxone administrations that were given in 2014. And this only accounts for EMS data. This doesn't account for the good work that the team at the health department is doing with giving naloxone to families. This doesn't account for the work that the law enforcement have been doing to administer naloxone on the streets. This is just EMS. And as you can see here, I would say that's about every neighborhood in this county has seen an overdose and have dealt with the issues of addiction. So it is in every neighborhood. All right. And has everyone heard of naloxone? That's a good point, Veronica. Okay. For some of you that may have not heard of naloxone, I won't do it justice today, but you can definitely talk to the health department. They'll definitely get you a kit through their Project On site if they have kits available. They do. She nodded her head yes. Naloxone is an overdose reversal drug. It in the instance of an overdose, if you think the person has been using or have a suspicion that a person has been using a drug, that they overdose from that drug and they look like they need some help, naloxone can reverse the impact the drug has on the brain and revive them until EMS can arrive for further assistance. And so I encourage you, if you know someone that has an addiction, to get a kit, work with the health department, and I'm sure that they'll talk about that more in a little bit. Long-term effects of opiates. Again, these trends negative. We have no idea, even if we get folks into recovery, what the long-term impacts this is going to have on their health. We're starting to see some of it in our assisted care facilities, assisted living facilities. We're starting to see people need amputations. We're starting to see people that have collapsed valves, infection of the heart, decreased liver function, all kinds of other health-related issues because they've been putting a poison, for lack of a better word, in their body for so many years. And now they're in recovery and they're still having some issues. And so we'll have to just see what this looks like as the years progress, but I have a feeling that we'll be talking about this a lot in the future when it comes to healthcare. Neonatal abstinence syndrome, or babies born dependent. Mothers who were using, who got pregnant, had a baby, the baby's born dependent on drugs. The number of these instances are disturbing. The brown areas on this map, and it's hard to see, but overall you'll see that it's an issue, indicate the number of people per 100,000 or per 1,000 babies born dependent. So remember Scioto County, little old Portsmouth, 76 babies out of every 1,000 babies were born dependent. Here in Portage County, 10 babies out of every 1,000 babies were born dependent. And this data was from 2015. There's still some other long-term issues that we haven't talked about, and I just want to touch on quickly since Veronica alluded to them. The things that we don't know, the other unknowns, are the children of these individuals. 57% of the folks in the care of the state are, of the children in the state are due to opiate addiction. I kind of messed that stat up. Let me say it again. 50% of the children in the care of the state are in the care of the state due to opiate addiction of their parents. And so, the long-term impacts of that when we look at trauma and how much higher percent of risk they're in to develop an issue themselves, we have some work to do, and we have our work cut out for us in the future. But there is hope. And man, I can't, I've been messed up since I heard you speak earlier, Kelly. There is hope and there's light at the end of the tunnel, and I think we'll spend the rest of the day kind of talking about we heard some pretty bad stuff. Let's talk about what we can do about it. I joined the heroin unit, as I said, a year ago, but the heroin unit has been put together by Attorney General DeWine since 2013. He saw the need for our team to go out around the state and find programs that work. He's like, there has to be programs that are working out there. I want you guys to go find them, and I want you to share the information with the rest of the state or any other area of the state. And that's exactly what we've been trying to do over the last few years. With that, we've seen a lot of positive trends. So we just talked about a lot of the negative. A lot of the positive is the increased use of medication-assisted treatment, which you'll hear about today. We see the increased use of naloxone. You'll hear about that again today. And we have in our office a rebate program. If you guys are interested in that rebate, please see us after. We can tell you more about it for law enforcement and EMS providers. If you're not getting a rebate and you're buying naloxone, come see us. We're seeing more and more awareness events, like the event this afternoon, that are reducing the stigma and letting people know that this is an issue so that they can have a conversation in their household and watch out for signs and symptoms. We see increased use of drug courts, which I won't talk about. We'll talk about that more today. And community engagement, recovery housing, housing for individuals that are in recovery is really what that is, along with a lot of other recovery supports, job support, just peer support, peers helping each other that are in recovery and helping others that are trying to be in recovery. So those are all good things that we see. Law enforcement's response. Thank you to the Sheriff's Office. Thank you for the Prosecutor's Office for allowing us to be here today. They have been tremendous in this fight against these drugs. And finally, good news in the world of legislation. What we've learned is that we have to engage every community, every sector of the community to fix this problem. As you look around, if you see any group that's listed on this list that should be represented here and they're not here, we need to make sure that we get in touch with them, because it takes every sector of the community to start to get down the right path. We've seen improvements in all of these areas, and I'll give you a couple examples in a minute. I don't want to run out of time here, but one of the things that we did to make this easier for you is provide a resource guide. And what this resource guide does is looks at all 12 sectors of the community, all areas of the state of Ohio, and all the work that we've been doing walking around the state, and condenses into a quick pamphlet, which you'll get on your way out, of the programs and services that are working in the state. So, for example, we know of a program in Ohio for businesses. The businesses are looking at healthcare options for their employees and saying what alternatives can we have to add-ons that we can have to the insurance plans to help individuals and their families who are struggling with these issues. So businesses are looking at this. Health departments are looking at this. They have used inspectors, health inspectors. That was in Summit County. Right after all this string of overdoses happened, the Summit County Health Department reached out to us, and we were able to work with them to engage the inspectors. So inspectors are being used in ways that they've never been used before. The faith-based community. I could go on and on and on and on, but what we did was summarize it here in this packet for you. So we'll make sure you get one of these on your way out.